Okay, ma'am.
Okay, so if you've read and understood considering its surgical pathology station, please tell me what is the provisional diagnosis for this patient that you will consider?
It may be the case of multiple endocrine neoplasia, ma'am.
Okay. How would you confirm your diagnosis?
I'll confirm my diagnosis by history, taking history, examination, and the examination investigation.
What investigations was my question would you
For
ask for?
yes, for this patient, I'll do the circulating insulin, proinsulin, C-peptide level, parathyroid hormone level, serum calcium level, and urinary vinyl mandelic acid level. I can do the CT scan or PET-CT.
Okay. How would you understand that this CT was done and it shows hyper-enhancing pancreatic lesions? What would you understand by that?
It may be the case of insulinoma, maybe.
All right. Uh, if you could tell me how an insulinoma should be diagnosed, what more can you do to confirm your
Yes,
diagnosis?
yes, ma'am. By history, I'll get the confusion, stupor, and loss of consciousness. And I'll
Okay.
do the investigation, insulin, proinsulin, C-peptide, and glucose level. And here is the circulating insulin to glucose ratio is increased, and C-peptide level also will be increased.
What are the genes which are responsible for the mutations in cases of insulinoma?
Yes, ma'am. Main gene one and the loss of mutation function of tumor suppressor gene PTN
And
and
these,
inactivation of function of inactivation of the mutation of two genes alpha thalassemia and mental retardation syndrome.
okay. And what are the two possible hypotheses which are when it comes to genes?
I'm sorry, ma'am.
Okay, what should be the insulin level
Yes,
for
it
a patient
will
to
be
yes,
less
more
than
than
2.8 millimole per liter, and it will be for diagnosis. It will be more than 10 insulin
10
level,
micromole per liter. Okay.
micromole per liter.
What are the
Yes.
blood tests that can be used for the diagnosis of insulinoma?
Yes, ma'am. Insulin, proinsulin, C-peptide, insulin glucose ratio,
And
and we
yeah,
can do the localized by the ultrasonogram, CT scan, MRI.
okay. What are the typical clinical picture with which a patient with insulinoma will present?
Yes, ma'am. We'll get the Whipple's diet. It includes the symptoms of hypoglycemia after exercise or fasting. The blood glucose level will be less than 2.8 millimole per liter, and symptoms improves after taking meal or intravenous glucose administration.
All right. If you could tell me what is another pathology that you could suspect in this patient?
Yes, patient may have the hyperparathyroidism,
All right.
maybe the anterior pituitary
Adenoma.
adenoma.
Okay. If you could tell me, first you said parathyroid hyperplasia. So how would you define hyperplasia?
Hyperplasia is the increase the number of cell in tissue in response to chemical, physical, or other stimuli.
In this condition, how many parathyroid glands can be affected?
Yes, all four glands may be affected.
What should be the microscopic picture of hyperplasia?
Okay, ma'am, I'll get the um, chief cell hyperplasia. It includes the diffuse and multinodular pattern, the less commonly water clear cell hyperplasia and isolated oxyphil cell, and the fibrous germs I will get in a microscope.
You try to treat the patient, but patient does not respond, or patient's hypoglycemia does not respond, you think of insulinoma. So can you tell this insulin can be derived from which cells?
It's beta cell of islands of Langerhans of pancreas.
Can you name few other conditions that can also cause hypoglycemia?
Yes, ma'am. Insulin-like growth factors secrete from the beta cell, diffuse liver disease,
Yes.
inherited glycogenesis, endocrine insulin production from
Ectopic source.
fibrosarcoma or retroperitoneal fibrosis.
Yes. All right. If you could tell me if patient have parathyroid and pancreatic involvement, you've told me there could be another pathology, which is pituitary adenoma.
Yes,
So
ma'am.
this will present with increase in
Prolactin
particular,
level.
yes, prolactin level. And okay. Right, what more I can ask you? All right, how would you differentiate MEN-1 syndrome from MEN-2 syndrome?
Okay, ma'am. In MEN-1, both and MEN-2 both are autosomal dominant condition. In MEN-1, there is three gland involvement. That is the anterior pituitary, that is the pituitary adenoma and primary hyperparathyroidism, and the pancreaticoduodenal endocrine tumor. In
What are the,
MEN-2,
yes.
in MEN-2, there is 2A and 2B. In 2A, pheochromocytoma, medullary thyroid carcinoma, and the medullary thyroid tumor, and the primary hyperparathyroidism. And in MEN-2B, medullary thyroid tumor, pheochromocytoma, and facial and oral mucosal neuroma, intestinal ganglioneuroma, and the Marfan's syndromes. In case of MEN-2, there is the well understood the genotype phenotype condition,
Okay.
red button cousin.
Please tell me in case if patient has pheochromocytoma, what test can you do in order to diagnose it or confirm it?
Yes, ma'am. I'll do the urinary metanephrine, normetanephrine level, vinyl mandelic acid level, catecholamine level, and I can also do the CT scan, MRI, and PET CT.
All right. Okay, thank you.
Thank you, ma'am.
Good.